How does cross-infection affect CF patients? Cross-infection in cystic fibrosis refers to the transmission of harmful bacteria or germs from one person with cystic fibrosis to another. This is a serious concern because individuals with cystic fibrosis have lungs that produce thick, sticky mucus. This mucus creates an environment where bacteria can thrive, leading to chronic infections. These infections can worsen lung damage, speed up lung function decline, and complicate treatment. Certain bacteria are particularly known for being transmitted through cross-infection among cystic fibrosis patients. One of the most common is Pseudomonas aeruginosa. This bacterium can be acquired from the environment, but it can also be passed between cystic fibrosis patients. When certain strains are transmitted, they may lead to more resistant infections that are harder to treat and can cause ongoing lung problems. Another serious bacterium is Burkholderia cepacia complex. This infection is especially concerning for cystic fibrosis patients because it is difficult to treat. It can be transmitted through direct contact, like kissing, or indirectly through contaminated objects. Infection with Burkholderia cepacia can limit future treatment options, including lung transplantation. Non-tuberculous mycobacteria are also a concern. These hardy bacteria can survive harsh conditions and disinfectants. Infections caused by non-tuberculous mycobacteria can vary in symptoms but can lead to severe respiratory issues in some cystic fibrosis patients. Cross-infection can occur through close physical contact, sharing personal items, or being in enclosed spaces together. To minimize this risk, cystic fibrosis care guidelines recommend maintaining a distance of at least 6 feet from one another, avoiding physical contact like shaking hands or hugging, and not sharing items that come into contact with mucus or sputum. This includes eating utensils, respiratory equipment, or toothbrushes. In healthcare settings, cystic fibrosis patients are often segregated during clinic visits to reduce the risk of cross-infection. When cystic fibrosis patients live together, they should take precautions to limit germ spread. This includes reducing contact with respiratory secretions and performing airway clearance therapies separately. Cross-infection leads to increased lung inflammation and mucus production, which further blocks airways and allows for more bacterial growth. This can accelerate lung damage and worsen overall health in cystic fibrosis patients. Therefore, infection surveillance and strict infection control practices are essential components of monitoring and managing health in cystic fibrosis. In summary, cross-infection significantly impacts cystic fibrosis patients by increasing the risk of acquiring difficult-to-treat lung infections, accelerating lung damage, complicating treatment options, and potentially affecting survival. Preventing cross-infection through physical distancing, hygiene, and careful monitoring is vital for maintaining lung health in individuals with cystic fibrosis. Always consult healthcare professionals for personalized advice and guidance.